So it can be either conducted individually or with a partner. This depends on your specific needs and goals. The number and frequency of sessions will vary depending on your individual situation and progress in therapy. First of all, you can expect to discuss your sexual history, experiences, and goals. Explore the emotional, psychological, and relationship factors that might be affecting your sex life or your sexuality. Develop strategies and techniques to improve your sexual experiences and relationship. Address any concerns or misunderstandings you might have about your sexuality. And also improve communication with your partner or partners about sexual issues. If the sexologist cannot help you, they will help derive you to another health professional or a sexologist who's more specialized on that specific problem. Since a sexologist can have different background in either medicine, psychology, or education, you might need to be derived to another professional. So there are many different techniques that are commonly used in therapy that can help people improve their sexual experiences and relationships. These techniques can vary depending on the individual's specific needs and goals, and also on the therapist's approach and training. Sexual education about sexuality, sexual anatomy, physiology, and function. Communication and intimacy building exercises, relationship skills training, sensate focus. This is a technique that involves touching and being touched in a non-sexual way. It can be done either alone or with one or several partners. The point is to increase intimacy and pleasure without the goal of sexual arousal or orgasm. Other techniques are relaxation and stress reduction techniques that help alleviate anxiety or performance pressure. Cognitive behavioral therapy. This is used to address negative thought patterns and behaviors that might be impacting sexual functions. Exercises to improve sexual function and performance, such as the Kegel exercises for women and penis pump use for men. Exploration of personal values, beliefs, and attitudes about sex and sexuality. Referrals to medical professionals for the evaluation and treatment of physical sexual dysfunctions with biological origins. These techniques are just a few examples of the techniques that may be used in sexual therapy. Your therapist will work with you to develop an individualist plan to address your specific needs and goals.